Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Thank you for the opportunity to present my result. My name is Nur Siyam and my partner is Miss Widya Hari Cahyati. I'm from Public Health Department, Universitas Negeri Semarang, Kampus Sekaran, Gunung Pati, Semarang, Indonesia. The research title is Intensive Care Coordination Method, or ICCM, Improve Clean and Healthy Lifestyle Habits to Prevent Breeding Place Factor. I will start from background. Based on the result of the research interview with one of the boarding school administrator, he explained that health problems related to infectious disease such as dermatitis, papulosis, tinea fascicolor, scabies, and dengue hemorrhagic fever had infected students in Islamic boarding school. It was reported that poor environmental hygiene and sanitation increase the incidence of this vector-borne disease. The individual hygiene behavior of students based on interviews is also still not good. For example, the behavior of rarely changing clothes, the habit of hanging clothes, the habits of borrowing friends' clothes, especially headscarves and jackets. Also, not washing dishes immediately after eating, and the lack of habit of draining the bathtub once a week. In avoiding and overcoming environmental health problem, students need support and assistance from various parties, including support from their friends and administrators or stakeholders. However, one thing that should not be forgotten is the awareness of the individual student themselves to change and to become disciplined individual in maintaining the hygiene and sanitation of the Islamic boarding school environment. Steps can be taken to build a clean and healthy lifestyle behavior. For one of them, by applying methods of intensive care coordination. ICCM application of this implies intensive coordination between the occupants of the boarding school to raise awareness of self-care and the creation of healthy environment at the boarding school. The aim of the research is the research objectives was the establishment of a model ICCM and getting an idea of the effectiveness of the model ICCM as an effort to improve hygiene and health behavior in adolescent girl boarding school occupants. The methods, the research was conducted at the Tahfidul Quran Islamic Boarding School, Miftahul Ulum, uh, Terboyo Wetan District, Genu, Semarang City. The result sample is a female student who have health problem and have unhealthy habits based on the result of the coordination of the boarding school administrators and stakeholders. And the number of research sample was 30 people. The method, this was a quasi-experiment with non-randomized one-group pretest post-test design. Data was collected by observation, interview, and questionnaire. Instrument, checklist observation, interview guide, and questionnaire. Data analyzed by univariable and bivariable with Wilcoxon test. ICCM research implementation, we can show in the figure. Number one is permission coordination with Islamic boarding school for the research process, and then analysis and identification of health problem that occur in the santry, intervention that have been carried out, analysis of impact and benefit, and then analysis of supporting and inhibiting factor and resources through interview with boarding school administrators. Number three, application of the ICCM method. Number one is assessment and mapping on implementation of introspective survey by student, agreement of the cause of health problem, and then formation of coordinating team for individual hygiene and environment sanitation. Each team consists of 5 students, and then making guidelines for clean and healthy lifestyle in Islamic boarding school. And then number five is implementation of the intervention in accordance with the result of the agreement on the implementation of ICCM by adjusting the condition owned by the pesantren. And then number five is the process measuring the effectiveness of the method with the Wilcoxon test. And the last is information dissemination. The result of the application of the model are presented to policymakers in the pesantren as a basis of consideration in implementing future intervention or program. Result and discussion. The result solved indicator of personal hygiene, environmental sanitation in the room, and a pledge to learn, environmental sanitation in latrines and ablution, and environmental sanitation in the yard between before and after application of ICCM in the boarding school is increased significantly. So clean and healthy behavior prevent breeding place vector disease in female santry and also increase significantly. Strengthening the internal coordination of the community in Islamic boarding school will increase cooperation and communication of students in conducting environmental monitoring to prevent factor bleeding place. Meanwhile, intensive self-care can improve clean and healthy living behavior in Islamic boarding school. The stakeholder in Islamic boarding school are the people who make policy decision, including policies in environmental management and determine in providing health education to encourage them to behave in a clean and healthy behaviors. We can show the table about the results of PHBS data processing before and after the application of the ICC method to reduce factor breeding place. Conclusion. The implementation of ICCM can improve indicator of personal hygiene, Islamic boarding school environmental sanitation in room and study areas, Islamic boarding school environmental sanitation in latrine and ablution place, and environmental sanitation in Islamic boarding school yard to prevent breeding place. A strong sense of kinship has been manifest in the application of the ICC method in Islamic boarding school and has success in realizing PHBS for a resident of Islamic boarding school. Thank you. That's all for me. Wassalamualaikum warahmatullahi wabarakatuh.